Good morning, everybody. I'm Sakti Oktaria Batubara from Kaohsiung Medical University, PhD student. Today, I want to present my study about self-regulation theory to examine illness perception, coping, and quality of life in patients with end-stage renal disease receiving hemodialysis, together with my professor, P. Oli. So, our statement as author, this study is part of my dissertation that will schedule for final defense on December 22, 2022. And the full article may sent to the Journal of Nursing Scholarship after receiving suggestion during final defense. And we have no conflict interest to disclosure. Outline of my presentation today is introduction, literature review, methods, results, discussion, and conclusion. As introduction, end-stage renal disease, as we know, is a serious renal damage and impaired function necessitates dialysis or a kidney transplant for a survival. Hemodialysis is a treatment to filter water and water from the blood and control blood pressure and balance essential minerals such as potassium, sodium, and calcium. In this world, there is a fast growth of patients who receive renal replacement therapy. By 2030 is predict 5.4 million will receive renal replacement therapy, and three parts of this world like Mexico, Taiwan, and Hungary are the highest prevalence. And in Indonesia itself, there is three provinces that have highest patient with receiving hemodialysis is in here, West Java, and East Java, and Central Java. And there are many impacts of hemodialysis, such as in mental, depression, poor quality of life, anxiety, in financial, transportation, tourist hemodialysis units, and pay caregiver, and in social, like isolation, because you have a weight condition or you shy about your condition, and also in physical, like change in skin color, fatigue, muscle cramps, or itching. And survival rate of patients receiving HAD is different in some countries, like in US, Taiwan, and Indonesia. For example, in USA, there is 57%, and in Taiwan is 66.4%. And in Indonesia, for patients that have 5 months after receiving hemodialysis, is only 47.8%. So is this because of their perception, coping, or health quality of life? So there are studies about illness perception in patients with end-stage renal disease in Indonesia, which is part of the common sense model illness representation component, but was not reported the relationship between every domain of illness perception with the outcome. And in two studies from Suji and Prativi, from Suji said that patient perception were negative and there is a relationship with treatment and adherence. And from Prativi, there is no relationship between illness perception and quality of life. So far, this is both of this. It's a study about end-stage renal disease from Indonesia. So the purpose of this study is to describe socio-demographic data, clinical characteristic, illness perception, coping, and health-related quality of life patient with end-stage renal disease receiving hemodialysis. The second is to examine whether the illness perception and coping were predictor of health-related quality of life in patient receiving hemodialysis. And the last is to examine coping as a mediator between illness perception and health-related quality of life in patient with receiving hemodialysis. So literature review, of course, this is about common sense model illness representation. As we know, is a dynamic and systematic process involving effort to modify and modulate thought, emotions, and action to attain goals. So there is three phase in this model, such as illness representation that have 9 domains. Coping procedure, there is adaptive coping, adaptive coping, and appraisal. In here, there is a health-related quality of life. So this is from the Leventhal in 1991. You can see in this picture. End-stage renal disease, as we know, is severe kidney damage and its function is very low, which need dialysis or kidney transplant for survival. The definition can be seen in the indicator from glomerular filtration rate is below 10 milliliter per minute for 1.73 meter degree. And the conceptual framework of my study here is there is social data and clinical data, illness perception, coping, and health outcome is health-related quality of life. So the method in this study is correlational model testing, cross-sectional approach, and done in eastern part of Indonesia, in East Nusa Tenggara province and Maluku province, in 6 hospitals, Kupang, and Ruteng, Maumere, Sumba, and Ambon. And the criteria for the patient is performing regular hemodialysis at least 3 months, age 18 years and over, able to communicate Bahasa Indonesia, and exclude if cognitive impairment, new patient for hemodialysis, and have diagnosed severe psychiatric. And the instrument used is for demographic and clinical data, brief COPE, IPKR, World Health Organization Quality of Life, BREF. And the analysis for the descriptive, I use frequency percentage, mean with standard deviation. And for the predictor, I use hierarchical multiple linear regression. And for testing mediator is multiple mediation analysis. And several ethical considerations have included in here: respect for human dignity, anonymity, confidentiality, beneficence, autonomy, informed consent, veracity, inducement, and justice. And for the inducement, patient have given 100,000 rupiah. And next we move to the result. For the result of the study, you can see here mostly is male, married, employee. And for the clinical data, the mean they have received hemodialysis is 29 months, is mean 2 years, more than 2 years. And for the IDWE is 2%, so it's quite good. And mostly have hypertension as etiology, and as a current disease also hypertension, and the hemoglobin is low, creatinine is high, and ureum also high. And for the domain of illness perception, the 9 domain of illness perception, you can see here the highest is personal control. Highest mean is as a personal control is a good, but from the consequence and emotional representation, if the highest mean is not good. And for the domain identity, because you need to separate it together with the cause, you need to separate it. You can see here that mostly participants have sleep difficulties, fatigue, nausea as a 3, the highest one. And for the cause of they get end-stage renal disease, they perceive it as a psychological attribution. And for the coping, the mean of coping, the highest mean is adaptive coping. So mostly participants use adaptive coping. And for the overall health-related quality of life, the mean is 61.48, is quite a little good. And the highest is psychological health, 67.92. And for a predictor, you can see here for every domain, health quality of life is a different. There is no one that's same for all. Like emotional representation can be found in as a predictor in physical health, social relationship, environment, but not in the physical health. The other one, like hemoglobin, no in the psychological health, and like timeline cyclical consequence no in the social relationship and environment. And adaptive coping, no in the psychological and environment. You can see in here for the last. And as predictor of overall heart quality of life, you can see the final model, the predictor is hemoglobin, timeline cyclical, consequence, coherence, emotional representation, and adaptive coping. And the highest of their exponent is emotional representation 0.36. So in average, 1 unit increase of emotional representation, it will be increase heart quality of life 0.36. So the final model is like this. Higher related quality of life in patient undergoing hemodialysis is 0.13 hemoglobin plus minus 0.15 timeline cyclical plus minus 0.25 consequence plus 0.12 coherence and plus 0.36 emotional representation plus 0.29 adaptive coping. And the indirect effect, there's indirect effect between emotional representation and health-related quality of life is 0.05 indirect effect. So for the discussion, participants perceive relative more emotional for all the domain. And they think receiving they may have stressor for the strict diet, they have and experience some symptoms such as itching and weak. And another thing that they think have emotional representation highest is because they experience presence of the arteriovenous fistula, which keep reminding the patient their need for the dialysis that make them stressed. And hemodialysis had a significant consequence. They think that continuous therapy causes patients to unable to work optimally, which led to negative perception. And they also think that hemodialysis impact their life, and they have experienced identity or symptom during their life like sleep difficulties, fatigue, loss of strength, nausea, dizziness, breathlessness, and stiff joint, high headache, and upset stomach. And in the study also found that patients perceive their illness relative not to chronic. Physician and nurses have explained it to patients, need to explain it more that this condition is chronic and they need the headache for their whole lives. However, they still put hope that hemodialysis will recover them from their illness. And in domain cause, the patient had CKD or end-stage renal disease, must receive HADI because of risk factors such as heredity, poor medical care in the past, behavior, aging, smoking, and alcohol. And personal and treatment control demonstrate more positivity as mean is good. And although the participant perceive more negative emotion, but they feel they can control their behavior and treatment. And the coherence domain was favorable by participant, mean the patient a little good in their understanding of this disease. And this finding may be influenced by factor, period of hemodialysis, educational background, and employment status. For the predictors of higher quality of life, they say that lower hemoglobin will be worse physical health, and coherence not too excessive, maybe because they, like I say before, background of education and excellent access to media for another study that says good as their coherence. And for the consequence, poor health-related quality of life associated with stronger belief that illness will have serious consequence. And emotional representation have a negative predictor of health-related quality of life in the study. And adaptive coping is a predictor to have a good health-related quality of life. And because the study has so that emotional representation, the relationship with the health-related quality of life mediated by coping, so it's consistent with the assumption of Howard in the common sense model illness. So patients receiving hemodialysis may use more than one coping to cope their situations. For example, when patients decide to have regular scheduled hemodialysis, they may want to focus that making a plan for what they should to improve their quality of life. So as the conclusion, most participants had a negative perception of hemodialysis, such as that it will last longer, will highly concern, and show more emotional response. Although they also have a positive perception, most participants also use adaptive coping. And the potential predictor that nurse can modify, maybe nurse will modify it in the future to enhance a clinical outcome, especially in health-related quality of life. Measuring illness perception and coping strategy is an excellent initial step to detecting which patients have a risk having poor health-related quality of life when receiving hemodialysis. And applying the self-regulation theory of the common sense model to patients receiving hemodialysis may help nurse detect and address patients in accurate understanding of their condition. Thank you very much.